Healthcare changes, like, I swear, on a daily basis. It's just constantly changing, and our patients look to us to be the ones that are giving them guidance and recommendations for the right type of care. And so if our nurses or our medical assistants are not up to date on what the current, procedures are, or the current medications, or what the current treatment is for something, then we're not going to be being able to treat that patient the way we want to, like that best care for the patient. My name is Kelley Sears, and I am the Director of Clinical Education and the Interim Director of Nursing and Convenient Care in West Warwick and Woonsocket. It's a new department. It started when I was hired, going on 2 years now. And we support the education of the clinical support staff. So mostly the registered nurses and the medical assistants. We do dabble a little bit in dental when things overlap between medical and dental. Sometimes we do a little bit of provider training, but mostly we focus on the training and education of medical assistants and RNs. Things in their job that are changing, new things that are coming to their job, things that are high risk for patients. So we're looking at things that we do well, that we don't do well, and then making decisions based on that data of what we should train on this year, what we should educate on. We ask the staff what they feel like their knowledge gaps are or their skill gaps, and then we develop educational curriculum based on those. We are constantly pivoting where our needs are and where our priorities are based on what the organization is going through. If we have a medical emergency, then we need to train more on code response or things like that. There are vaccine recommendations that come out, right? So RSV vaccines, or when we had MPV last year, there was the MPV vaccine or things like that. So when those things come out from the CDC, or different recommendations are passed down from different medical organizations, then we have to kind of pivot what we're doing to do education. We do a preceptor workshop for nurses and medical assistants. That's a 3-part series. We educate on a whole bunch of different topics across all the sites, really. I'm very psyched to be part of this community. And when I talk about a community, I'm at every site. I mostly work with staff, but I have had the opportunity to work with patients, and we're doing something different every day, and I really love my job. And now that I've gotten into convenient care, I see a whole different aspect too, outside of education, and I'm enjoying learning all about that. The people have been fantastic, really welcoming of the education department, very easy to partner with. The opportunities here are so great for growth in our staff and for growth within us as individuals. And I don't know, I just really love my job, and I really love being at Thundermist, and I love the people that I work with every day on both my teams and the teams that we teach and that we help, and the patients that we serve by educating those teams. I am Thundermist.